The NTV takes you inside an intensive care unit ward where critical patients are taken care of, and the COVID-19 pandemic has stretched out such facilities in other parts of the world. Leila Mohammed went into one such ward at the Aga Khan University Hospital to find out what goes on in there to ensure the patients who are brought in live in good health.
It has been a month and a half since Kenya recorded her first case of positive COVID-19 in the country, and with just about 300 cases, it is said that 10% of those end up behind such doors in ICU facilities in hospitals across this country, and some have been admitted here at the ICU in the Aga Khan Hospital. And this morning we find out how doctors have been able to take care of them until when they were moved to the general wards. Beyond this corridor is a red barrier that demarcates the COVID-19 intensive care unit. Not much is happening here this morning, as all 5 active coronavirus cases that were here have either fully recovered or no longer in critical condition. In the ideal COVID-19 situation, the nurse taking care of the patient would suit up in special garb to prevent themselves from the virus infections as they set up the patient for medical examination. And when the patient is ready, the doctor checks key organs which give an understanding of his patient's status.
This is a young, healthy volunteer who's simulating this. Respirations, anywhere between 12 and 20 would be acceptable. In our case, we're usually dealing with low blood pressure.
Dr. Martin Musumbi is an internal medicine physician at the Aga Khan University Hospital. On a typical day, he'd look out for other complications that may arise from the patient's dependence on machines as well as lack of mobility.
To prevent muscular atrophy, we do actually have our nursing staff do physiotherapy. We can either use compression devices to keep the patient from developing blood clots in the legs, which will typically transform into blood clots in the lungs, which is what you hear people calling pulmonary embolisms or PEs. Sometimes when somebody is intubated and has a breathing machine, they do develop what we call gastric ulcers, or they do develop bleeding in the stomach. So we actually will give them medications.
Patients on ventilators can sometimes develop complications with oral hygiene.
We actually do pay very good attention to oral hygiene of the patient, and we use certain things that would actually inhibit bacterial growth in the mouth, which can lead into developing pneumonia.
And just like elsewhere around the world battling an unfamiliar enemy, each case successfully treated has reacted differently to the medication.
I really can't say that this medication has worked or this medication has not worked. We have tried various medications. We've tried hydroxychloroquine on our patients. We have tried antibodies on our patients. We have tried some antibiotics on some of our patients. Some of them were able to tolerate some of those medications, and some were not able to.
Researchers all over the world are in a rush to develop a definitive treatment method and medicines for COVID-19. Dr. Musumba says the novel nature of the disease makes this challenging.
Of course, it varies from patient to patient. It depends on how well you respond to the management. You have to realize that with COVID care, there's quite a few treatments that are out there available, and people are talking about them. But none of them have been definitively proven to be a cure, so to speak, for COVID-19. There's a few promising treatments out there. But as far as response, it's basically how well the person is able to fight off the infection. And so that time period varies. We are seeing anywhere from between 7 days to 14 days.
While critical care in ICU facilities is quite pricey, the hospital administration says it is difficult to put a definitive figure to the treatment at this stage.
You can be in intensive care unit, not on a ventilator. You can be in intensive care unit on a ventilator and you need dialysis, okay? The complexity of the disease impacts the cost.
The hospital is handling less critical cases in its isolation wards, but the But the management is, however, keenly monitoring the national testing and tallying and are on call. Leila Mohammed, NTV.